In this episode of MTV's True Life, we follow Emily, the 18-year-old with a traumatic brain injury.
My name is Emily. I'm 18 years old and I have a traumatic brain injury. It all happened when I went to the lake with my friends and family. I accidentally hit the throttle of my jet ski and went slamming into another friend's jet ski. The next thing I remember is waking up in the hospital.
We were at the lake and we were riding on our jet skis like usual. She thought that it'd be a good idea to hit the throttle on her jet ski and subsequently send her jet ski shooting at my jet ski. And when that happened, she kind of fell off it a little bit and she smacked her head really hard on the front of it on my jet ski because she was flung forward. She kind of just lost all control and we were all real scared and we maybe thought that she'd be all right and she'd walk it off. But no, we all had to go and get the doctors involved and had to go to the hospital. And it was real crazy. We were all worried about Emily.
The MRI study did show a subdural hematoma in the parietal lobe. When Emily arrived at the hospital, she was unconscious. And her Glasgow Coma Scale score was 7, which is significant for severe brain injury and trauma. She was admitted to the hospital in the unit for 6 days. She's going to require significant speech therapy. She also developed seizures while in the hospital and is going to require neuroleptic medications.
I had just started my freshman year of college and I was extremely excited for new beginnings. But then I realized I could not handle all the work that was given to me. I could not concentrate on any of the tests or homework that my teachers had assigned me. I then realized I had to drop out. It has been extremely hard for me and I'm not really sure how I'm going to go on right now. Worst symptoms I've had ever since my brain injury has been having terrible headaches. They're so bad that I spend most of my days in my room with the lights off. I can barely function anymore without having severe pain. I don't know what else to do. I've tried to take medicine, I've tried to take Advil, but it just won't go away.
It's been so hard since this accident happened to Emily. It's been hard, I know, the hardest on her, but hard on all of us too. She's changed so much. She used to be so outgoing and always just the happiest one, always making new friends, the first one to go out and organize activities. And ever since this happened, she's changed.
Overall, I deal with a lot of depression and anxiety because of what happened. I pushed away a lot of my friends and I feel extremely lonely a lot of the time. A lot of my friends continue to go into their freshman year of college, and since I had to leave, I just continually feel left out and it's been really hard.
She stays in her room a lot, she has mood swings, she has seizures. So we just hope that she continues to make improvements.
Hi, I'm Dr. Michelle. I am Emily's speech-language pathologist, and I'm just going to be going over a few of the therapy techniques and approaches that we specifically used for Emily. I want to start off by saying that many patients with TBIs are not immediately testable or treatable due to their inability to attend. Some patients are comatose, some patients are semi-comatose, and this obviously affects their ability to respond to visual or verbal stimuli. And Emily was able to undergo a screening to evaluate her cognitive and linguistic skills. We started working on therapy approaches. There are a few therapy techniques and approaches that can be combined in order to provide the maximum support for a patient with TBI. We combined environmental control, orientation therapy, cognitive retraining, and compensatory training. These are all speech therapy approaches that I will explain in detail. The environmental control approach can be completed in part just by having a complete, organized set schedule. We completed a schedule for her. It was very organized and had a layout of her various activities throughout the day. We had her meals set up for the same time, the same days, the same location. We had her rehabilitation program sessions on the same time, the same days, the same locations. We even had a sleeping schedule set up for her in the morning and at night because she was having trouble with her sleeping patterns. The main goal for this approach is to minimize any confusion or agitation that may be occurring. We want to allow the patient to use their cognitive energy to better manage themselves. Next approach, it is the orientation therapy approach. This one is a more basic approach. The main goal is to gain back this orientation ×4. Gaining their orientation back helps them better manage themselves. It helps them gain their independence. And another important skill to remember with the orientation approach is repetition. It's important to repeat certain tasks throughout the day to really get that memory going in the brain. The next approach that we focused on was the compensatory training approach. Patients with moderate to severe TBIs, they need extra strategies to manage these tasks that they could have managed independently premorbidly. Emily was taught to have daily notebooks and to write in them to remind her of appointments or just to clear her mind on a day when she was feeling extra emotional. These tasks are really, really good for compensatory training. The next one is the cognitive retraining approach. This approach is directed at increasing the skills of cognition. So there are several different components in cognition, but the main two that we focused on with Emily were attention and memory. So we started off with attention because attention is the structure for all the other components. We need to know that our patient can hold attention and can respond in order to even look at the next steps. So we worked on attention and then we moved on to memory. So we integrated memory slowly, but we incorporated, recalling specific tasks, sequences, behaviors, recalling biographical information, collaboration with family and friends who can help integrate all of this information from rehabilitation back into the home. This approach specifically is used to help the patient redevelop their ability to organize information and to also gain some of that independence back.
One of the things I've been working on with my speech therapist is getting pieces of paper and writing down daily tasks that I need to do. Since I have really bad short-term memory loss, it's been really helping me throughout the days.
Hi, my name is Melanie and I have known Emily for years. I was very shocked to find out about her traumatic brain injury incident. This actually inspired me to do some research online, some common misconceptions of people who experience TBIs. Patients with TBIs are affected in different ways. A lot of people seem to believe that knowing which parts of the brain are affected will help determine exactly which struggles and challenges that this individual will go through. And while it will help, it's not really good to rely on just the parts of the brain that were affected. And a lot of behaviors can occur that aren't expected from the beginning. Another misconception that I remember reading was that patients with TBIs lose their emotional basic needs. This one is very, very false. Patients with TBIs are humans just like you and I. One of the last misconceptions that I read about was that the recovery time is the same for every patient, and this is absolutely not true. Many people show improvement at different rates. It's important not to hold each patient to the same standard when it comes to recovery.
In the past, I would spend days on days wishing that what happened at the lake never happened. But all I can do now is to have hope and keep working hard. With the help of my parents, speech therapist, and doctor, I've been able to do that. Day by day, I have been getting better, and I hope to start college back soon.